Yeah, absolutely. And thank you for having me, Cassie,
Thank
today.
you.
I'm excited.
Mhm.
My name is Shana. I grew up in Montclair, New Jersey, and I went to undergraduate and graduate or PT school in Boston University. I started my career in Brooklyn and Park Slope, and that's where I've been for the last 7+ years now. I do specialize in pelvic health, but also in lymphedema and breast rehabilitation as well. So I do orthopedic as well, but those, I spend most of my time treating the pelvic health population. So yeah, I love all things movement. That's what really brought me into this profession. I dance, I do yoga, I teach yoga,
Oh, wow.
run, play soccer, snowboarding, weightlifting, climbing, and now that I'm in the suburbs, probably some more pickleball. But um, I just had my first daughter in April, so
Aw,
7 months ago now.
congrats.
And thanks. So we're moving back to the suburbs, and that's really what ultimately kind of how I found better with physical therapy. And I'm really excited to join. I mean, everyone, as we kind of were mentioning, is so welcoming, and everyone just really seems to have a passion for like learning, and that enthusiasm just seems really apparent. So it's really excited, and I'm excited to help them grow and help serve their community by offering the pelvic health services.
Yeah, I think it'll definitely help us grow a lot having that service. So we're really excited. And it is a great place to learn. I film their Wednesday sessions with clinical time and study hall on Fridays.
Yeah.
And they amaze me every time. Like I learned something new. A lot of it seems like it's like a different language to me because I'm not a PT. I do their marketing, but so it's very interesting though, just to hear everyone share ideas and learn all the new things, and just stay on top of everything. So yeah,
Yeah, it seems so like collaborative, and yeah, I'm excited to just learn more too, because you can always learn so much from just new environment, new people. So
that's true.
yeah.
Yeah, and we have some good snowboarding places by us. I snowboard too, so we'll have to go.
Oh yeah, yeah, you'll have to let me know.
Yeah, right. So what inspired you to specialize in pelvic health?
Yeah, I actually love this question because I think that's a common one that I do get a lot, and I think you're kind of introduced to it. We had like a guest lecture in PT school because it's not part of the core curriculum. You do need to have some more continuing education after graduating from PT school. So, but I think really the interest is really shared amongst people in general, not just people in this field or practitioners. It's just from a desire to learn more about how your own body works. And so the pelvic region, has so many different body systems involved in it: digestive system, reproductive system, urinary, excretory system. So it can be quite complex. So the challenge of that is I really love that. The problems can be experienced from all genders, and it's less talked about even with their own providers or amongst like your friends and family. So I guess I particularly love breaking this taboo of talking about pelvic, I guess, issues, and offering a space where people can feel comfortable talking about their experiences, asking questions, learning about how their own body works, and ultimately, like when seeking help if they need it.
Yeah, yeah, I think that's awesome. Oh wow. So a lot of people still don't realize what pelvic health is in physical therapy, especially. So in simple terms, what kind of is a way to sum up pelvic health physical therapy?
Yeah, I think that's a really common question too. I think a lot of people coming in even into their first appointment, they're like, I don't really know, what I'm here for, how you can help me. And
Yeah.
so I do a lot of is explaining that. But pelvic health physical therapy is just a specialized therapy for all ages and genders, and it addresses dysfunction specific in the pelvic region. So that can include urinary issues, bowel issues, sexual dysfunction, pain syndromes, pelvic organ prolapse, post-surgical. It's a very generalized list.
Mhm.
But typically, we address these dysfunctions. We do an evaluation and treatment, and evaluation and treatment of the pelvic floor muscles themselves, the nervous system around it, even surrounding areas like the hips, spine, abdomen. And so I actually like to call it pelvic and abdominal rehab because we often do include treatment of the abdomen and the core. So it is physical therapy. It's just of these specific groups of muscles
Yeah,
in the area.
it's very interesting. Can both men and women benefit from that?
Yeah, yeah. As I mentioned, all ages and genders. That's a common misconception is that it's just for females, but males, they also have a pelvic floor and they can absolutely benefit from therapy. There's also a whole world of pediatric pelvic therapy, but I treat adults right now, and I don't specialize in the pediatric. But there's more continued education, and there are people that help children through any pelvic issues too.
Wow, okay. Um, what does a typical first visit look like to you? I know some people, you said some people that come in and they kind of are like, "What am I here for?" I bet it's kind of like an uncomfortable, situation for some people. So what does a typical first visit look like, and how do you help patients feel comfortable talking about such personal topics?
Yeah, yeah. So when you're on your first visit, it's kind of like regular PT. We'll sit down, we'll have a conversation, take a thorough history of any symptoms, anything medically relevant. So we do spend a good deal chatting first, and that's the history part of the exam, and then we move into a physical exam, which can include again regular orthopedic evaluation, posture, breathing, looking at back, looking at hips, so looking at other parts of the body, and then working into if patient is comfortable and everyone's on board doing a pelvic floor assessment. So evaluating the muscles and tissues of the pelvic floor. That can be an external exam where we just stay external, or it could be an external and internal portion, and that's something I speak with people and explain as we go and make sure it's really understood before we go through. So that's the evaluation portion, and then usually on the first day too, I'll send people home with kind of a starter program, some exercises, some behavioral modifications, just something to go home with so they can start their program. And we set a plan together of how often you want to come, how much therapy I think is needed, and so we kind of set that plan on that first day and make sure um, it's working toward the patient's goals and everyone's on board.
Okay, awesome. That seems like a pretty simple process for people to, kind of understand and grasp. And you seem super sweet too. So it's easy to talk to you, which helps.
Yeah, that's what I'm hoping, and that's what you're saying too. Like, how do you make people feel comfortable? That was the other part of your question too. Um, it's probably just really, 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 really listening first, and really never assuming anything, especially in such a sensitive area, can be potentially sensitive. Consent is always ongoing, it's never assumed. So, you never assume the patient's comfort level, explaining everything in great detail. You set expectations, you move very slowly or as quick as comfortable, really. And so, I recognize this is people really need to be very vulnerable when they come to see me, and for certain things especially. And so I'm just grateful people allow me to treat them and trust me with their care. So people come as they are, and then you just kind of meet them where they're at.
Yeah. No, that's great. That's a great approach, I think. How does pelvic health PT support people before or after childbirth?
Yeah, so specifically with the prenatal and postpartum population, I think it's a time in someone's life that can be really especially helpful to come to pelvic rehab. Certainly people might not have any issues before after, but I think things do kind of crop up, different aches and pains, different urinary issues like incontinence that can kind of appear and or intermittently come and go throughout that period. And a lot of people will accept it as a part of the journey. And I think it actually can be something that you seek help for and have support with throughout. And so if there's even ever a question of like, do you think pelvic floor can benefit me? This is prenatal, postpartum, or otherwise. Like, it's better to just come in, have an evaluation, kind of see and how we could potentially help. And I think that's the better approach. But yes, just supporting people also postpartum too. It's a big change in your body and your life, and so it's just another person, your physical therapist, kind of on your team, trying to help you get back to yourself in
Yeah.
a time where you can feel a little bit less so.
Yeah.
Uh,
Having that support, I think, is great.
yeah.
That extra, extra support in a time where you especially really need it. So,
There's a lot of questions like, what can I do? How fast can I go back to it? Whether that's
yeah.
physical activity, sexual activity, anything really. So I think there's a lot of just questions surrounding pregnancy and postpartum that can also just be, really well trained in that,
Yeah.
to just, help you feel supported, especially sometimes with certain doctor's appointments, it can feel very quick. So we have a lot more time with patients to allow for that discussion and I guess comfort level to build too.
Yeah.
Mhm.
That's great. Um, so with that, or just with any conditions, really, what are some techniques or exercises that you typically use for pelvic health PT?
Yeah, there's always an individualized approach, I would say, but generally using a combination of manual techniques, exercises, of course, and I think lots and lots of education is a big part of our specialization as well. So hands-on techniques, they can be done directly to the pelvic floor or indirectly to the pelvic floor to other parts of the body. So myofascial release, soft tissue mobilization, visceral mobilization, joint mobilization, stretches, things like that. That's like kind of the hands-on piece that we can include. And then depending on what the patient requires, exercises really vary a lot.
Yeah.
Just depends on what the patient needs. It can be training the pelvic floor muscles like in isolation, integrated into functional exercises for strength and endurance. So it could be strengthening, it could be endurance, but I would actually say more often of the time the goal is for pelvic floor relaxation, and that's actually more what people sometimes need for their symptoms. But
Yeah.
definitely talk more about that too.
Definitely. Yeah. So with exercise, that's a good probably lifestyle habit to have with this. Are there any other lifestyle habits that can improve your pelvic health?
Yeah, so in part of our programming, I think it's in addition to like what you would think of as in physical therapy, exercises and manual treatments, we do a lot of counseling on education. So that can include um, diet and fluid intake, your what you eat, what you drink, stress levels, breathing patterns, lots of ergonomics with sitting, sleeping, carrying, holding, breastfeeding, whatever it is. How you wash yourself, patterns around going to the bathroom is a really big one.
Wow.
That can really be well targeted for symptoms like urinary frequency, urgency, things like that. And even just habits with exercise, I think. So I'm kind of giving general vague list of things,
That's
but
okay.
the
Yeah.
detailed in whatever people need.
Yeah, I think it's very interesting. There's a lot I didn't know a lot about a lot of that. So this is, new to me too. So I'm like,
That's what I love is
wow.
just people like once you ask a question, it kind of begets more questions, and then there's a lot of people realize they don't know about I guess their own bodies too.
Yeah, I know. I'm like so excited to like learn more from you. I'm like I'm like, when
Yeah,
is December?
first patient.
Are you're coming end of December or
Yeah, I
yeah.
think the second week of December is
Oh,
how we
okay.
have it planned right
That's
now.
exciting. It'll come up quick.
I know it's coming.
Yeah, that's so exciting. What is something that most people misunderstand about pelvic health?
Yeah, again, a very very common. There's a bunch of things, I guess, but I think the main thing is kind of what I alluded to, is that most people come in maybe with the assumption or the thinking that they need a lot of strengthening. They have a weak pelvic floor and they need to do a lot of Kegels or pelvic floor contraction exercises to get stronger, which can absolutely be the case in some people. Um, but I would say, as I mentioned before, like that piece of relaxation, finding length, finding mobility is actually one of the more commonly needed, and sometimes it's a combination of both, certainly. So it's that's something I think that people don't realize too. There's not just the strength piece of it.
Oh, okay.
It's
So
also
not like just Kegels then.
not just it can certainly be helpful, and there's definitely a time and place for it.
Yeah,
Um,
but it's like
yeah,
a
there's
combination of more, I guess.
there's like we find balance and we find more like dynamic function rather than just like one mode of strong all the time, right?
Yeah. Okay. Yeah, no, that totally makes sense actually.
Yeah, and then I guess other common misconceptions would be that, um, yeah, like I think I said this before. People commonly just accept that they have to have these symptoms, and that they assume that they can't be helped, and that if there's ever a question if you have a symptom, just coming to an evaluation and just seeing if that is something that we can help with is definitely doesn't hurt.
Yeah, better to be safe, right?
Yeah, and then also that males can't receive pelvic therapy. That's a misconception as well because they can.
Yeah,
Mhm.
that is true.
And so it's we do a lot in our field also trying to just spread awareness and education to providers so that they also can use us as a resource and be able to refer their patients to the right people with these specialized skills. And I think it is definitely getting better. Like it's not like a secret, but I think that it can be even more so like where people are. It becomes more commonplace and more comfortable where people can just go and it's not maybe as I said before a taboo or like this very specialized place that people go to in like dire circumstances.
Yeah, no, totally,
Yeah.
totally get that. More common and more
Yeah, more
um
commonly just accepted like, oh yeah, when you're pregnant, that's where you go.
yeah, yeah, right. Oh, well, that was awesome. That was very informative. I learned a lot just from this. So thank you. I appreciate that.
Yeah, of course. And if you have more questions, follow later. Definitely, we can do this again or, dive into something more specific at another time.